COVID cases down in the U.S., but cases are on the rise again overseas. The U.K. has seen more than 1.4 million cases in the last 28 days, and more than 50 million people in China are now under lockdown as the country faces its worst COVID crisis since early 2020. Is this an indicator for what's to come here in the U.S.? Let's bring in ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel. For more, you're someone that would love no more daylight savings time, right? Because you never sleep, Dr. Patel.
Oh, I'm all about it. It never made sense to me to begin with, and it seems like everyone's on board. Now, if only the Senate could be on board with getting Americans health care and doing everything else after we get past the Sunshine Act, then we'll all be high-fiving.
I knew you would have something to say. All right. On a much serious note, something we should be talking about is this uptick in the cases of COVID in Europe and also parts of Asia. So, I mean, bottom line, should we be worried here in the U.S.?
You know, Kira, I don't know if we should go as far as saying that we should be worried, but we should at least be prepared and expecting, not necessarily saying it may not happen, but we should be expecting a rise in that subvariant BA2 over here, because Europe usually is showing us what we can see in the future. There's a prediction there, and this is going to be the fifth surge, if you will, that we could potentially expect here. Now, there's a different scenario in different countries playing out right now. China had a strict no lockdown policy, so their level of natural infection is going to be lower than other parts of the country. What is concerning, however, is when we look at Western Europe, when we look at Hong Kong and New Zealand, we are still seeing cases among those who were vaccinated in the past. And we're still seeing a rise in hospitalizations among elderly individuals or those who are high risk in places like Germany. So we just need to be doing everything we can to brace what could potentially be happening here, as we also see a similar trend. And that's the lifting of restrictions, complacency, the fact that BA2 may be a little bit more contagious, and that people may have some waning immunity from their previous vaccine. So all of it needs to be taken into stride as we think about our own individual risk moving forward.
So let me ask you about this CDC report that was released on wastewater that suggests infection rates may be on the rise. What does the wastewater data actually tell us?
Well, wastewater is pretty fascinating in terms of detecting. It's a valuable public health tool. Long story short, if we look at the wastewater and look at the genetic material of SARS-CoV-2 in that wastewater, we have a good prediction of a rise in cases in many places throughout the country. Now, if you look at the over 600 wastewater sites the CDC has been monitoring, over 30%, almost 40% have shown an increase. In Kira, some of those sites, about 15, have shown an almost 1,000% increase. Now, people might be saying, well, we're not seeing an increase in testing. That's because not all testing is being tracked anymore. We have testing happening at home. We have a lot of people who aren't getting tested. So wastewater is an accurate prediction tool. The question now comes down is, what are we going to do with that information, especially as we're lifting restrictions across the country?
Got it. All right, so the White House is now asking for about $22.5 billion in COVID funding from Congress, citing in a letter to Speaker Pelosi that the rising cases abroad make funding here at home all the more urgent. What's the potential impact of cutting out these federal COVID programs?
Well, Kira, the potential impact comes down into preparation. As we heard, this money could be affecting our source of vaccines, of testing available for everyone, antivirals, monoclonal antibodies, especially for those who don't have insurance and need that treatment free of charge. We're talking about cases in Europe and Asia. We're talking about wastewater surveillance. In a worst case scenario, in a new surge or new variant, are we going to be prepared? And that's in question right now that we have this loss of funding. I can't get into the politics behind it, but we certainly need to be more prepared than we are right now.
All right, Dr. Patel, great to see you. It's been a while.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.